Just want to show you how I started my day of work by cleaning up everything on my desk first, especially those with a polished surface or smooth surface with a baby handkerchief or a cotton pad. First you clean the keyboard, because cotton has a natural antiseptics. It can destroy many viruses. Okay, clean the phone, clean the stapler, and especially the mouse. Clean your phone, clean the mouse. Okay, because during the night many viruses may be deposited on the surface, and some smooth surface like the stapler virus there can live for 12 hours or more. The drinking cup I use is the a brass type. Brass is metal. Metal have self-cleaning properties because it has the it can produce ion, and ion can destroy the membranes of the virus and even destroy bacteria. Okay, of course you have to wash your cup. Okay, now I have to start work, and by going into people, I use the phone to scan around for infected people. Okay, this is a Caterpillar S16. Can scan around. Of course there's nobody here, but you can detect it, some heats there, so it's good to detect the people who is already in fever. When I go into the lift, I will use this to scan around. And talking about the mask, which I just use this kind of surgical mask. If you have, I usually use for a few days. So actually, is mask useful or not? Because it is debatable. Many scientists and doctors said mask cannot protect you from the infection. Even the World Health Organization, WHO, said so. My opinion is mask is useful, although it cannot stop the infection. But because the main purpose of the mask is to protect the humidity inside the nose. Okay, when you are fully covered up, there won't be many humidity loss. If the nostril inside kept moistened, it is a natural defense line of your body. Okay, it will sucking. I mean, all the virus going through the nose will be contacted by the hairs with the nose fluid. They can destroy them, and other bacteria as well. It's a very efficient system. If the system fails, second defense line is our stomach. The fluid will continue to flow down with the still alive virus or bacteria down to the stomach, and at that time they will be gone. So no one can resist the acidic inside the stomach. Okay, so as long as you can keep the humidity in the surrounding areas, you may not need a mask at all. Just use your nose to protect you. Based on the statistics in Hong Kong and the Western hospital, the people wearing a mask or without wearing a mask gives a lot of differences. That's why in the Worldometer, if you check it on the internet, there are big differences of the COVID-19. Mainly is many cases are mild, okay, but many cases are severe. How's that? The main question is they forgot about the quantity of the infection. If you infected with large quantity of virus, very bad. You will be due to severe cases. If the mask or the nose shield is sufficient to stop or to reduce the quantity of the virus, you most probably into the mild case. So wearing a mask is better for you, especially in the Western world, because their humidity in this time is quite low. You have to maintain that to about 70. You have to feel your nose to be wet, okay? Thanks.